Good morning, everyone. Good afternoon or good evening, wherever you may be joining us in this special Asia Society online program, part of our special online programming about the coronavirus outbreak and all its global impact and implications. I'm Tom Nagorski. I'm the Executive Vice President of the Asia Society. Today, we take up a phrase that I don't think was really in the public dialogue or the lexicon until recently, unless you were a statistician or maybe an economist, and that is flattening the curve. Three words that any country or community, and that's pretty much any country and community around the world, has now become familiar with. Phrase meaning roughly easing the severity of the COVID outbreak wherever it has gone. And we focus today on a success story when it comes to flattening the curve, a success story in Asia that is getting a lot of deserved attention, and that is South Korea. We'll also look at some of the lessons that may be learned from the South Korean example, and we'll take a look at something of a COVID mystery, which is what is or is not happening in terms of the coronavirus in North Korea. We have two great guests joining us in this Asia Society event. Jeongmin Kim, Seoul correspondent at NK News with the Korea Risk Group. Jeongmin previously worked at the CSIS Korea chair and in the Seoul Bureau for the Reuters news agency. Great to have her with us. And John Delury, longtime friend of the Asia Society, alumnus, I should say, of our Asia 21 Young Leaders Network, a professor at Yonsei University Graduate School of International Studies in South Korea. Both our guests joining us from Seoul. I'm in New York. John Delury, also author with Orville Schell of the great book, Wealth and Power, China's Long March to the 21st Century. As we get started here, just a reminder to those of you watching around the world, we are restreaming all these events to Facebook Live and to YouTube. Whichever platform you are watching, they both have comment functions. You put your comments up and your questions, and we'll get to as many of those as we can as well. So, flattening the curve in South Korea. Just a couple of facts and figures to get us started. I promise not to drown you in these, but less than 1 month ago, and this is particularly profound for someone sitting in New York, where we are seeing a curve that is anything but flat at the moment. But about a month ago, South Korea was seeing north of 900 new cases a day, confirmed cases. The surge looked very steep. It had begun with a big cluster around a religious community. We'll get to that also. And they were seeing a doubling of cases daily, exactly the pattern that has hit so many other parts of the world. Italy, New York now, and others. Except that then, in fairly rapid fashion, as these things go, the curve leveled off. The cases began to be cut in half with each passing day, rather than the doubling phenomenon. Now down into the 40s and 50s per day. So a huge surge, and that big curve really never came. So first, I want to ask both of our guests. Jeongmin, why don't I start with you? Just for those of us who are not in Korea, give us a sense, just a few weeks since those very tough days in Seoul and beyond. To what extent is COVID-19 still a part of the consciousness and the daily life for you as we speak now in late March?
When it started, there was a bit of a fear, a lot of fear actually, and panic. But right now, after KCDC flattened the curve, and we are getting all these emergency alerts whenever we are living near a confirmed case, people are feeling a little bit more comfortable with going out wearing masks, although people are refraining from going to public gatherings, public places, restaurants. And right now we are seeing the downward fashion of the number of confirmed cases every day. And it's also two-digit number these days, 91 new after March 26th, when it hit March 27 morning. People seem to be having more trust in the government's response to controlling and containing the disease.
I should say, you bring up a point about schools and other things, Jeongmin, but John Delury, we'll get to in a moment to some of the tactics that were used in South Korea. But am I right that the big lockdown in terms of economic life, life in general, to what extent did that come or did not come in South Korea?
Yeah, well, I don't think it would be appropriate to describe South Korea as ever being in a situation of lockdown. You know, I'm from Northern California and constantly in touch, certainly with my mom and stepdad and family and friends. And as you know, they actually a little, I think, before New York, were in shelter-in-place orders. You know, and we didn't really have that level of restriction, or certainly if you look at Wuhan and Hubei and other parts of China, you know, quite draconian measures to stop people from going out with police enforcement. That's just never happened in South Korea. So I do think that's very important. There was one moment where, you know, there was kind of a flurry of, it seemed like maybe the government and some politicians mentioned the need for something like a lockdown of Daegu, the hard-hit city in the southern part of the country. And you know, you see how democracy works. There was immediate blowback in the media among the political opposition that said we are not locking down Daegu, and the politician who mentioned that backtracked, and everyone, the system immediately backtracked from that. And South Korea has managed to get through this initial, certainly put out a wildfire of a massive infection cluster, to do it without a lockdown. I think that's fair to say.
So it's really interesting in many ways, because here, of course, same debates. I'm sure they have existed in some fashion in every place that's been touched by COVID. But I was going to wait to get to this, but let's help the audience a little bit for those who are not familiar with the geography and the source of this first outbreak. So Daegu, and in particular a religious community there. And Jeongmin, maybe you can speak for a moment about that community. But it seemed that at a moment when there were only, I think, a handful, 10 or 11 or 12 confirmed cases, a huge testing protocol went into place, testing kits produced. But Jeongmin, can you just tell us a little bit about this place? Because every country and community has its sort of first big cluster. And this was an interesting one in many ways. Can you help us to understand the church and the community and what happened there?
Sure. So one of the first cases, I think it was 31st, this person was part of a religious group called Shincheonji. And this person infected a lot of people, especially in the area of Daegu City and also the area around Daegu. And it was because of a church gathering that was held, where there were these people were tightly seated, and they were holding this religious ceremony, and a bunch of these people from this church, they contracted the coronavirus. And after that, because they moved around in the city and also outside, the big cluster happened in Daegu.
And they did not, am I right that that community, for I guess you could say religious reasons, they did not want originally, or they were not responsive to public health officials coming to them to test?
Well, not all of them, but they were criticized by some South Korean citizens for not abiding by the quarantine rules. Shincheonji, it's not considered Orthodox, and many of them are hiding their religion in South Korea for some reason, and also some of them were very adamant about not going public about their beliefs or whether they contacted the confirmed cases. So what happened was that the South Korean citizens went after them to track their private information and find out who's Shincheonji member. And then there was a brief moment in the South Korean government discussing whether all of these members of Shincheonji group should be tested. And they did start with that, but then at a certain point, they stopped it for some reason. But then there was a debate whether or not a certain religious group should be a target of such testing.
So here we have, let's come back to John Delury then. We have a situation which sounds just a recipe for a nightmare, because as you said, there are debates about, how much of a lockdown to have. There's debates about what to do with this community that's having one of the first clusters and first outbreaks. And yet again, we're talking 4, 5, 6 weeks ago max. Here we are today. So first of all, step one, I guess, is the testing. How did they in South Korea get so quickly, just to throw out another number, 100,000 kits in production almost immediately? I guess they had many on hand. 300,000 tests at the high point administered every day. Was South Korea just A, super prepared for this, or B, just super fast in its response?
Well, first of all, Tom, let me maybe correct one of those numbers. I don't think it was ever at the order of 300,000 a day. I think it's about 20,000 was probably the max. Yeah, and about over 350,000 cumulative at this point. But still, to be at 10, 20,000 a day when they needed it was an extraordinary achievement, and way ahead of the curve. So South Korea is right, and Americans are right to have been looking at South Korea and saying, what is wrong with our system, with our leadership? I think, if you look, and there's been good reporting that I've read and followed on this, that's detailed what happened, which is that, here the system worked, the government worked, the leadership at KCDC worked well, and the private sector worked together, immediately recognized the seriousness of the threat. It could be the fact that China's next door, and when China coughs, we feel it, and so that maybe just the geography, there was no sense of false security that Americans or Europeans may have felt. You don't feel that in Korea, but the system went to work. The government did what it needed to do to give some regulatory room for private companies to quickly develop the test kits, and then also the lab capacity. That's a big bottleneck in the United States, from my understanding of it. There's not just the kits; you got to have the technicians and the labs to find the results. And so all of that capacity was ramped up very quickly. So the government and the private sector worked well here together, and for a while it was excess capacity, but then due to that cluster infection we described with the Shincheonji sect, they were ready to go, and they could quickly start doing all the testing that they need to do, starting with that group and then moving beyond it. So it's a lesson. I mean, I think the United States is now trying desperately to catch up and has done a little bit of catch up, but still, if you look at it per capita and you look across the United States, all effort has to go into replicating some version of that success.
So let's come to Jeongmin Kim. The pandemic preparedness is another phrase. It's maybe not as fancy sounding as flattening the curve, but again, clearly problems in the United States and other parts of the world. Does part of the preparedness that South Korea clearly had have to do with the MERS contagion that it experienced a few years ago, Middle East Respiratory Syndrome, or SARS, which I gather you lived through, Jeongmin?
Yes, I had SARS when I was in high school, so I remember that very clearly. There was already the infrastructure, the basic infrastructure, and the norm about self-isolation in South Korea, in the knowledge of the South Koreans. I remember that when I was in high school, I was in a dorm and I caught SARS, and the school was basically under isolation. All the students were not allowed to go outside, and we always the teachers checked our temperature like every 3 hours. So that kind of system and the knowledge of the need to take these diseases seriously, I think it mattered a lot when we were handling this COVID case, although it was much serious with the vaccine not available. I think I should mention healthcare system as well. Yeah. Adding to what John said, people here are not really afraid of going to the hospitals. because the Korean healthcare system allows people to get medical treatment without having, most of the times, without having private insurances, health insurances. When this happened, people all went to the hospital when they had certain symptoms. And when the government started to see that the hospitals lacked capacity to see all of the patients, they started handing out this guideline that they have to call a certain number first before going to the hospitals and getting checked up, or going through the drive-through testing booths to figure out whether or not their symptoms sound like COVID.
Yeah. So they had experience in a comfort level. I guess that's probably not the right phrase. You've both made the point in our conversations prior to this event that testing is one thing, but then of course it's what you do with the information you get. And here I find it very interesting. And John, maybe you can take us through just some of the, a lot of this involves high tech and IT. Walk us through, if you could, what happened in those early stages when, with the data that was amassed through the testing protocols.
Yeah, well, one thing, kind of a placeholder, I want to come back to Jeongmin's point about the healthcare system overall, because I think that's very important. And, you know, as an American who's experienced the American system and now being here for 10 years, the contrasts are really stark. And I think that's, but maybe we can come back to that point.
Feel free to get at it now while it's on our minds, sure.
Okay, well, it's hot. Yeah, I mean, I realize this is contentious in the United States, and hopefully you're getting, you know, we'll get comments from this and we can have a discussion if there are viewers out there with different views. But, you know, I would say that what you do see in Korea, this is what Americans would call, you know, a universal single payer, basically nationalized healthcare system. And, you know, you see the incredible advantages of that, frankly, because the system can coordinate a response to a public health crisis. The system knows how to work together already. Resources can be marshaled and mobilized from one place to the other. The public health sector, to begin with, is well funded. Because it has to be, because it's not competing with all the private sector, insurance companies and private hospitals. That whole, you know, ecosystem in the United States doesn't exist here. And you know, I've been looking into this a little bit more. I've experienced it as a patient and as a father who has sick kids. But if you just look at the numbers, Koreans pay less for their healthcare system. They get better outcomes. And you really see in a crisis the way the system can mobilize. And I think what we're seeing in the United States is stuff that's very hard to fix because it's deeply ingrained in a private for-profit healthcare system that has a very difficult time responding to a public health emergency.
Yeah, no, these are good points. And thank you for that. Let's come back now to, I guess, that tech question. I'm not sure it is entirely a tech question, but what happened to the information that was gleaned from all those tests from a technical standpoint and a spread the information standpoint?
I'll say a couple things, and then I'll punt to Jeongmin. Especially, you asked about the early stages, and I should be clear. We came back with the family. We were abroad and came back just as the numbers started to spike here. But what I can say experientially is, again, in stark contrast to what I understand the way that information is flowing in the United States at a local level. I mean, literally just before we started this, I'm sure Jeongmin got one too. We got automated, you know, our phones buzz basically whether we want them to or not. Throughout the day, we're getting emergency messages with information, targeted information about confirmed cases in our neighborhoods in Seoul. So she's in a different part of the city. She's getting a different message than I'm getting. We'll get some general messages to everyone, reinforcing the importance of social distancing, for example. But then we'll get what I think is so critical and distinctive in the Korean approach is I will get information about within my part of the city, whether there are any cases. And that works in really interesting ways. I think it's very important. And I do think this is something Americans maybe at the county, city, and state level need to think about going forward. The effect of that kind of micro information, especially as this process wears on, as you realize it doesn't just suddenly go away. So far, we're finding we have to live with this for longer than we would certainly hope. When you get that information, first of all, you do feel a little safer in your immediate neighborhood,
Right.
when your phone is buzzing, but it's not telling you, that there are cases down the block. And so I've noticed differences. For example, our family's in-laws early on were one of the areas in Seoul with the highest concentration of cases. It was actually still a very small number, but proportionally it was the most. And so people didn't go out at all there, basically. Whereas in our neighborhood, we only had cases very recently. And frankly, even during the peak of social distancing, people were still out and about. So, when you get to that problem, because you do have to figure out how to keep life going on, you have to keep the economy, the society, the politics functioning, getting that information at your neighborhood level makes a huge difference. And so that's one very fundamental part of the Korean strategy is the test gives you, this data, and then it is immediately flowing out to the public so that quite detailed information about what's going on in your neighborhood.
And I guess I gather that part of that information is gleaned and reminds us a little bit of what you see in China or maybe in Singapore as well. There's a lot of collection of data. So let's say, God forbid, one of you, let's say, John, you got the virus, that they then would burrow in, or some of these apps would make use of a lot of data about you to, I guess, not out you in any way, but just sort of track you around. And I don't know exactly how they all work, but these sort of, apps that are Corona maps, if you will. Now, much has been said here as we hear about such things that, would never wash in Europe or the United States because we're not ready. I mean, look at our attitudes towards Facebook and some of the other big data companies, or for that matter, generally speaking, American attitudes towards letting the government have a ton of our data and privacy rules. Jeongmin, you made the point to me earlier that cultural norms played a role here because the public was just all in and okay with the kinds of things John was just talking about. Is that a fair point?
Yes. So I think I should explain it in two different sense. One is civil society level, another one is the government level. So this Corona map thing, it was created by a bunch of students and engineers who just wanted to provide information for people who wanted to know with an easy one look where the confirmed cases were moving around and where their residents are. And then it started very simply, and then a lot of engineers joined their forces together to create it more informative. And then on the government level, these emergency alerts that John mentioned, these not only track where you live, but also, I have no idea how they know that, but for example, because I'm enrolled in Seoul National University and also I'm working at Jongno area, I'm getting all these emergency alerts from Jongno in my residential area and the school area. So they have this information on where people are. And another thing is that in America, I think that this would be considered a very serious privacy issue. But when you click on the emergency alert, they have a link. And these local government offices, they track down the information of the confirmed cases, like where they use their credit cards, and looking at the security cameras, they list where they have been going. So what I would say is that although culturally people seem to be okay with the government tracking the information of the suspected or confirmed cases, but although they are kind of giving up on their right to privacy, they are gaining the freedom of movement and the freedom of economic activities because for one thing, there was not much hoarding in South Korea. It's very different from other countries where they were, people were lining up at the grocery stores to buy all these toilet papers. At first, people were trying to hoard masks, but that was about it. And because people didn't really have this uncertainty about where these confirmed cases are and where they are moving around, I think people were less fearful of what is going to happen in the coming weeks.
Right.
So I think, this was mentioned by William Gallo of VOA. There is this swapping of certain freedoms, like, choosing certain freedoms over something else in the time of crisis. These different institutions of different types of democracy, I think citizens are responding very differently to the government responses.
Right.
Yeah, if I can jump in on that, Tom.
Sure.
I again watching, especially in Northern California, where I'm kind of most concerned about my own relations. I mean, I have to say, I guess I've been Koreanized culturally, because I am shocked at how little information there is and how hard it is. If you live in like my hometown of Sacramento, California, it's impossible to find out information, basic information. I mean,
you mean about who has cases?
Yeah, I mean, and there's plenty of ways to obfuscate the identity. And in fact, about 2 weeks ago, the KCDC, the Korean CDC, which incidentally, to my understanding, was created after SARS as part of the response to SARS, and has really been doing, I think everyone in Korea would agree, has just done an extraordinary job. They issued new guidelines to say, okay, we need to be more careful to protect identity, but to still give as much information as we possibly can. But I contrast that with a place like Sacramento, where the county health department only releases the new numbers of cases and deaths Monday, Wednesday, Friday of the week. And when anyone asks, when the media says, can you tell us anything about where these are happening? And there are there are infection clusters in the Sacramento area, they say we can't, because of privacy. So I fully understand Americans' concerns about privacy, and they're very legitimate, but a balance has to be struck. And I would say at least parts of the United States are way off to one end of the spectrum, at least in a case, Koreans care about privacy. It's not like we like people going through, or Koreans like people going through credit card receipts, but you recognize that this is not a normal situation. And temporarily, this is a feisty democracy. They just impeached their last president, but temporarily people accept these things for a public good.
It's a very, I mean, and your perspective, especially John, given that you straddle both East and West in this case, is interesting. But you're right, and you have to wonder whether when this is behind us all, assuming it will once and for all be behind us, whether that will be one of the reckonings here in discussions, because it's one thing to have a hypothetical discussion or a principled discussion about the privacy questions, but as you say, that we've seen and are going through these very traumatic times, whether a balance will be struck. I do want to, we're all, I'm probably the most guilty referring to the South Korean situation in the past tense here. And we have a question from a viewer on YouTube that maybe would be a bit of a corrective. Marian Fila asks, I've heard many people no longer practice social distancing, and that there is an expectation of life coming slowly back to normal in Korea in April. Do you think testing will be enough to prevent a second wave? Either one of you want to, I mean, is this in the rearview mirror in South Korea just yet?
I would say, may I? Yes, I would say it's a third wave, because there was the first imported case, and then the second one was a Daegu one. And the third one right now that people are most concerned about, and the government is most concerned about, is the additional imported cases from the United States and also Europe, where all these mostly the students who were studying in places abroad, they are coming back to Korea. And I think the question from the viewer comes from the recent incident where this student who was studying in America came back to Korea and didn't really wasn't really fully abiding by the social distancing rule and walking around Jeju and all that. And it seemed that she was infected and she infected a lot of other people. But when it comes to social distancing, at the first, with the first question, Tom, you asked us like how much this is our life now. I think people, although people are wearing masks and going out to see the cherry blossoms and everything, people are still very aware that they have to stay away at least like 2 meters from each other and that they have to wear masks and they have to carry sanitizers. And the government is constantly saying at least until April 6th, April 5th, people have to, the companies have to abide by the government recommendation that if ever it's possible, people should be working remotely or taking a leave of absence from time to time in order to continue the social distancing. So I wouldn't say that social distancing is gone. It's still there.
Mm-hmm.
Yeah, let me jump in on that. Hello to Marion, and that's a very good question. And to build on what Jeongmin said, I'm, this issue, we are not epidemiologists here, but one thing that is striking about the Korean data, which is very easy to find on the KCDC website, and experts have noticed this, is a very high percentage. It's been hovering 25 to 30% of the cases have been people in their 20s. And there was, because this Shincheonji sect is disproportionately, we think, women in their 20s, so that may have skewed the data a little bit, but it seems to be still holding at a very high level, even as it's gone beyond that sect. I think we all know Anna Fifield. I just saw some data she posted from New Zealand. There's a much smaller sample, but also shows a lot of cases in the 20s. And so this goes to Jeongmin's point. I mean, as a university professor, I'm ready to teach online as long as we need to. As the father of 3 kids under 12, I'm eager for elementary schools to resume as soon as it's safe.
Yeah, why are they not walking behind you there, John? Have you ordered them away somewhere?
Well, they'll pop up eventually. But no, in seriousness, these are big, tricky problems, right? Especially as this goes on. And I know my friends in the United States, everyone is struggling with this question of schools. But I do think, since there's some indication that you have a lot of carriers in the 20s, and Jeongmin's talked about this with some examples. As she points out, this is the big problem right now, is return students who are coming from essentially hotspots. I'm especially worried about the United States. Yep. I think at this point, I may be overly optimistic. The prime minister, who's kind of the Pence role as kind of heading this charge, he actually came out today and he reminded people, don't get complacent about this. Because actually, I would say in our neighborhood, I could feel it was a lot looser today. It was really nice weather. And the numbers, as you said, Tom, have been kind of going down, and it's human nature. You just start, coming out of the woodwork.
Yep.
So, back to the question, no, it's not over. It still casts a shadow on everything. We still need to be very careful. Again, for example, with resuming classes, but also just young people are together, and there's risk of more clusters. So there's still a great deal of vigilance. At the same time, it's very hard to manage this, and I think this is one thing we are a little bit, Jeongmin and I, speaking from the future to some communities in the United States. There's like New York right now is in a very different place. You guys are dealing with the really frightening part of the brunt of it. But New York later and other communities in the United States, you have to manage sort of the sustainability of living with this for weeks and maybe months. And that raises a whole set of issues that, that we're grappling with still, definitely in Korea, not over. So
I'm mindful of the time. We want to get to the COVID situation in North Korea. But before I do, there is an interesting question from online here about US troops in South Korea. And one forgets, well, you guys don't forget, and at the Asia Society we don't forget, but there are roughly 30,000 American forces stationed in South Korea. And in a way, because it came to South Korea early, this was really the first large-scale population of Americans, and they are, set off in Seoul from the rest of the community. But do either of you have any intel on how they have coped as in facing COVID?
Well, I'll jump in. I mean, it was really interesting to watch through actually their social media. They led the charge, and they have, actually there's not much US military presence now in Seoul, but there's a huge base where they've kind of consolidated in the city of Pyeongtaek in sort of central Korea. But there's an active base in Daegu in the hard hit area, and they did have cases there. And I think now they're getting some cases at the main base as well, Camp Humphreys. So, but what I would say overall is USFK, US Forces Korea, the first large community of Americans who were facing the brunt of COVID-19. And they did, I think, a very impressive job. And their commander, General Abrams, was constantly messaging vigilance, close coordination with South Korea, with the KCDC, working very well together. And, in a way, I felt their message was one that Americans needed to hear a while ago. Before, frankly, America was taking this very seriously. Here was a group of Americans who you can kind of relate to saying, don't mess around with this thing, and practicing, in a way that especially military units can practice, strict social distancing and those kinds of things. So yeah, it's been interesting to watch, but I think they're still struggling with it. I mean, in just following the reports, there's still cases popping up of USFK soldiers, or there's a large, probably twice that number, twice the 30,000 number of dependents and employees that are kind of the larger USFK community.
So let's, well, actually, I'm going to put in your minds, because it may take a little while to think about this, to park a question that's just come in over Facebook Live. Who are the real heroes, would you say, thus far, or who have been? You've mentioned the KCDC a couple of times, but if you had to identify individuals or institutions who really deserve a great deal of praise for South Korea's success. But let's come back to that and go to the North, which we've been promising. I know both of you are qualified to talk about this, but Jeongmin, really, this is your, I don't want to say life's work. You're one of that small community who try to divine what's going on up there. And it's never easy, no matter what we're talking about. But you talk about different responses globally, government to government, to the coronavirus. And not surprisingly, North Korea will probably not behave like most, if not any other nation. All we really know, I guess, is that they have not reported a single case of COVID-19. And there have been, interestingly, requests, I don't know if it's come from Kim Jong-un himself or from his government, requests this week for aid and assistance. Why don't you read some tea leaves for us, Jeongmin? What can you tell us about what you think is going on in North Korea as far as the virus goes?
Well, technically, I would say that, well, at least North Korea said that Trump suggested that he would have cooperation with Kim Jong-un regarding the quarantine measures. Overall, right now, North Korea's main line of strategy is border shutdown. A lot of media outlets use this term hermit kingdom, and they are more of a hermit kingdom, like more than ever, I would say that. And there were other diseases before, but then this time the quarantine measures are very unprecedentedly strict. They continue to claim that there's no cases of COVID-19, and recently the Minister of Foreign Affairs, it called North Korea a clean land, and boasted of it. About what's going on the ground, I would have to say that this is not based on what we are hearing from the people on the ground, but these are what's available in the open source, according to their newspapers and the state media. They say that over 380 foreigners were quarantined, but right now it seems that they have become a little bit more confident about their measures. So only one foreigner is under isolation. And there were these bits and bobs of how many people were quarantined in the provinces in North Korea. And my math was that it's somewhere near 10,000 were under isolation and what they call medical observation. But as of this morning, they said that only 2,000 plus people were isolated nationwide. The main line of propaganda North Korea is pushing right now is that they are implementing national emergency quarantine system that started on January 30th. And they put up this emergency quarantine command as well. And after Kim Jong-un held this really powerful Politburo meeting, they started using this term super special quarantine measures. And the daily sections, like people ask me if North Koreans are being informed about what's going on in the world. And I would say yes. Although it's the North Korean version, the daily section of KCTV, which is state television, and Rodong Sinmun, they have been for weeks dedicating a certain section for informing the WHO guidelines and how many people were infected in South Korea and China and whatnot. And they continue to claim that prevention measure is like a national survival. And also domestic quarantine measures are very, very strong. It seems that they're taking it very seriously. With the foreign embassy staffs and diplomats, they were under a very strict 1 month plus quarantine. And one of the Russian diplomats said that it was basically like a house arrest. But right now, some of them flew out on March 9, and they can visit a few of the stores, but they are still under very strict quarantine measures. And the citizens are educated to always wear masks and wash hands and disinfect their offices, and that they are strictly forbidding public gatherings, which is like a North Korean version of social distancing. And they also postponed their spring semester and the public amenities, some of them very famous, the new Yangdeok Springs Hot Springs Resort and the Mashingneong ski resort, they are all temporarily closed as of February 25th. And they also claim to mass produce these hazmat suits and disinfectants, sanitizers, and masks. And they suspended tourism, and the flights and trains to China and Russia, they're all suspended. And they are also having this really strict 10-day rule for all the imported cargoes, and that they can't really touch them until 10 days has passed.
So here's so here's a fundamental question. I mean, I guess it in a way it stands to reason that they'd be very forthcoming about the global news, because, as you say, the global news right now, from their standpoint, looks like all these nightmares all over the world, and they're saying they have no cases and they're a success story and all the things you just mentioned. Maybe a tough question to answer, but do you think that if, first of all, do we think they are, do we have any way to know whether they are really testing? Do they have the capacity to do that? And second, if they did have, whether they were some of the few foreigners there or North Korean citizens, if they did have an outbreak of a few hundred or what have you cases, do you think they would share that with the world?
John?
Yeah, maybe I'll jump in here. To my knowledge, they do. I think we can deduce they have some capacity to test. I've tried hard and talked to a lot of people to figure out what it would be. But there's, you can actually look through the UN, because humanitarian groups and even the WHO has to get waivers from a UN committee, sanctions waivers, even for COVID-19 medical supplies. And so they list publicly detailed information and that about what they're applying for the waivers for. And that includes test kit related materials. The Russian government also said they sent 1,500 test kits. I think the big X factor is how much China helped from an early stage. Actually, one interesting thing that didn't get a lot of attention is relatively early on in this, I can't think of the date off the top of my head, but I was checking the daily, like Jeongmin reads the North Korean daily, I was reading the Chinese People's Daily, and there on the front page of the People's Daily was sort of a thank you note from Xi Jinping to Kim Jong-un for his support. And the North Koreans put this message out as well, including aid, that North Korea was giving aid. And some people kind of laugh this off, but the Chinese took it seriously and reported it in their newspaper that North Korea was giving them aid. I think that is, now this is inference here, but I think that was part of also North Korea receiving help from China. Of course, neither of them want this to get out of control. That's not good for either side. So, but a lot in the China-North Korea relationship does not get reported. So I think I have a slightly, I don't know if I disagree with Jeongmin. That was an incredibly thorough account. I've thought a lot about the North Korean situation, and I would just add to your question, Tom, one thing we saw about Kim Jong-un very early on that sort of surprised observers is the way he acknowledged failures. The classic example was the first big satellite test that puttered out, and everyone was ready for him to say, oh no, it was a great success. And he had the announcers say, okay, it failed, we'll try again. And they tried again in December and it succeeded. And he's done that many times. It's kind of a trademark that actually he's more forthcoming, also more quickly forthcoming about failures, about things going wrong. Actually, it happened with Hanoi. He didn't pretend that Hanoi was this great success. He came out and explained to the people why it was a failure. So also, I was in Vietnam. I'll try to make this quick, but in the early stages of this, and I don't want to overdo, Vietnam and North Korea are extremely different. But in some ways, I think there's similarities in that, countries with socialist traditions, with an emphasis on public health, and sometimes, Vietnam is much wealthier than North Korea, but poorer countries can focus more on public health. They don't do our high-end catering to individual care. Their public health resources are focused very much on the entire public, and they're good at the kind of, in a way, social distancing can come quite naturally to North Korea. Neighborhoods are well organized. You get the message out to everyone. You have all these top-down levers, even more than what's possible in China, which is a much more kind of dynamic and loose society. So, actually, my guess would be North Korea has been able to keep this under control. I'm not saying it's really zero cases, but I think they are able to manage it. They took it extremely seriously earlier than basically anyone. They shut down their border, and there's not a lot of contact to begin with. They constantly talk about it in their media. So I think they're still vigilant about it, but I think they've managed at great sacrifice maybe to prevent any serious spread of COVID to this stage.
We do have one question I want to get to from someone you probably both know, Jeongmin Kim at Voice of America, watching over YouTube today. And it's an interesting question, given that we're sitting here now in the United States with more cases than even China had, and growing, and North Korea reportedly at zero. But she asks, should the United States and global society help and provide equipment, disinfecting tools, supportive measures, even though North Korea has said their positive number is zero, and then adds, which seems too unclear and suspicious. You've mentioned that North Koreans are offering help to others, but should the United States help if asked, and in what fashion? It seems, as I say, an odd thing to be considering right now, but either one of you want to take that?
It's a question.
Go ahead, John.
You start, John. No, it's good.
Oh, well, anyone who knows my views on North Korea knows what I'm going to say, which is, of course, we should, whether it's the United States, South Korea should offer it. The WHO has and should offer it really to any country at this stage. When you're in a pandemic, now is not the time, to try to figure out how sanctions enforcement are going to get you denuclearization, which they weren't doing anyway.
Right.
Not to surprise your viewers with that fact. So, North Korea, insofar as they want and are willing to receive international cooperation, just like other countries, because some countries are better at certain things than others. The international community should support them with that. That seems just kind of basic common sense. I've argued that I don't think they have a major outbreak. That doesn't mean they couldn't. And if they did, that's going to be, potentially a nightmare, a new wave for us in South Korea, in China across the border. So it's not that hard to make a common good argument that when you're in a pandemic, you look for ways to support really all countries in their efforts to manage, to prevent, to contain. That would be my
That is certainly, you're not the only one, and we're not the only ones, but that is sort of from the Asia Society playbook at the moment. Our CEO, Josette Sheeran, actually just wrote an editorial the other day on exactly that point, that this is not a time for, this is a time for global collaboration and cooperation and coalitions wherever we can find them. Let's come back then to wrap things. It's been a great discussion. We've covered, the power of testing and preparedness and tracing and IT and the healthcare system and global collaboration. But come back to that interesting question a Facebook viewer had about if you had to single out an individual or an institution that you think really deserves great credit for foresight or for thinking, for any of the things we've discussed in South Korea, who would you single out? Let's start with you, Jeongmin.
It's a tough question because I feel like this was a joint effort, and this didn't succeed because like a certain institution or individual made a heroic move. I know that many people are referring to KCDC as a hero, and it has a point, and I do agree. But I feel like the citizens' response, it was one of the most important factors in flattening the curve. All in all, like aside from a few exceptions, I thought that the South Korean citizens responded in a very civil way, uniting and coordinating and following the rules. And also joining efforts, their talents in their IT industry or whatever they can do to share information. And they also started a lot of like hashtag movements or whatnot, because it's a very highly connected society. People try to raise awareness on their own. So if I have to choose a hero, I would say, any South Korean citizen who tried to contribute to raising awareness.
That's a tough answer to follow, John.
I don't want to go after that. That's kind of a perfect answer. Don't make me speak, Tom. I mean, I really, you can't improve on that. That's a great answer, and I would agree. I guess we could say it's kind of interesting, and I generally like the President Moon Jae-in, but I would not immediately go to him, and that kind of is interesting. Not that he's made mistakes, but there's been a lot of criticism throughout the process. And sometimes that surprises my American friends who just assume, he must be at 90% approval ratings, because most of the coverage, especially now, is quite positive of South Korea. And I've seen his numbers are ticking upwards. And I think generally, especially more recently, people kind of recognize that the government's done a good job and he's done a good job. But, in a way, this kind of goes back to Jeongmin's point. I think one thing that's great about Korea is even when, comparatively speaking, the government is probably doing a really good job, people are pissed off about stuff, so people were mad, and it's in the press, that why didn't we close the border earlier to China? Where are the masks? There's been weeks of, we need 5 billion more masks here. Even though, again, compared with the United States, I think there's been a better flow of masks. But even President Moon, who's probably done overall a competent job, is constantly under a healthy amount of criticism from experts, from doctors, from the media, from the opposition. And so it's the other side of these privacy issues. It shows the health of the democracy. And that Korea has an active citizenry who will make, sacrifices, but are vigilant, have a common spirit. You do feel that, and that's quite impressive. So I agree with Jeongmin. Great answer.
So we're going to leave it there. Just a couple of notes from us at the Asia Society. First of all, thank you both. A great conversation. Thanks all of you around the world who've joined us. I want to thank my colleagues for helping again stitch our guests together, even though we no longer are on our stage at the Asia Society headquarters. Just next up in these online programs that we're doing, one very in line with what we've talked about today. Kevin Rudd, the head of the Asia Society Policy Institute, will be in conversation on Tuesday with a leading public health official in Singapore, which is another country that has gotten a lot of praise. They now have a new uptick, I believe, of cases, but they've done very well again at flattening the curve. And then on Monday, we'll have a special conversation that's at noon Eastern time on one of the really nasty byproducts, nothing to do with public health, but the racism and xenophobia that have surfaced in many parts of the world in the wake of the coronavirus. That is Monday, noon Eastern time. We hope you'll join us then. We hope you'll come to asiasociety.org for updates on all these events. And above all, we hope you stay safe and well, wherever you are. We're all in this together. Thanks for joining us.
Thank you, Tom.
Thank you.